Hi, Jack Canfield here, and welcome to Talking About Success. My first guest today is Michael Morgan, whose mission it is to significantly reduce the deaths from Alzheimer's worldwide in the next 5 years. Michael is the author of Body Energy Longevity Prescription. I want to read the subtitle, How Craniosacral Therapy Helps Prevent Alzheimer's and Dementia While Improving the Quality of Your Life. And he is an expert in craniosacral therapy, a healthcare modality which offers the promise of preventing or even reversing Alzheimer's disease. Welcome. This is such an important topic. I read in CNN just the other day, I wasn't watching a video, I was reading what was written on the internet, and it said that Alzheimer's has the potential of bankrupting the Medicare system.
Right.
That's amazing. So what you're doing is really important. So what got you on this mission? How'd you get started with Alzheimer's and with craniosacral therapy and this whole focus you now have?
Well, thanks for having me here today.
I'm glad to have you here.
First thing I noticed is that something happened very tragically in my family, which has happened to a lot of people, is my stepmother Edith and then my sister-in-law Carol died of Alzheimer's. And I had been teaching craniosacral therapy for the Upledger Institute for the last 10 years or so, and I thought, is there anything that craniosacral therapy can do to help with this prevention? Because we'd had good results with autism and people with closed head injuries, NFL players, any number of other immune system disorders, and I thought maybe it could help with craniosacral therapy, which I've been doing for some 10 years as it was. So I started to research. And what happened was that with some nurses at the University of Iowa, they helped me put together a pilot study. And we looked at people who had mid to late stage dementia. And all we did was this thing called a craniosacral therapy still point for 5 to 10 minutes every day for 6 weeks. And we found out we got clinical and statistical significance, meaning that people began to recognize their caregivers. We had one 100-year-old lady that began to speak in complete sentences, and they began to be aware of their surroundings, and things started to come back. After about 3 weeks of just 10 minutes a day, we started to see the shift. So that encouraged me to say, hey, maybe there's something we can pursue with this.
Okay, a couple of words that I'm sure my viewers aren't that familiar with. Craniosacral therapy, what is it? And what is this still point?
Craniosacral therapy is a technique developed by osteopath John Upledger in the mid-1970s. And it's a way, you know how doctors can kind of feel the pulse, or they can feel the respiration? It's another way that anyone can learn how to listen to the flow of cerebrospinal fluid in the body. Now that sounds kind of fancy, but all it means is the head can expand and contract very slightly, and the body can kind of rotate in and out. And with about a day of instruction, people can begin to feel, oh, I feel this. And the bones are connected to this membrane system inside the head. And the bottom line is this helps reset the central nervous system. It's like rebooting your computer or pushing that red reset button on your furnace. And it can help the whole system start to change and enliven and evolve. And a still point is one of the techniques that is 5 minutes or 10 minutes worth. It's like a mini craniosacral treatment. So even if you don't know anything else, it allows the whole mind and body to settle down, get calmer, and cleanse the body of old toxins, old twists and turns in the body like that.
And I think you said, because you did this to me before we came on air, and you put your hands on my shoulders, and then I started to relax. I could feel it.
Yeah.
And you were saying, though, that when this cerebral spinal fluid is flowing correctly and all that's going on there, actually it's removing toxins from the brain?
Yes.
And when those toxins aren't removed from the brain, what happens?
Well, when I gave a TED Talk last year, I made an analogy. It's like a river. There's all of these billions of microchannels in the brain, and new research from University of Rochester and other places talk about the lymphatic system, a way that there's drainage in the brain. And what happens as we get older is people that are middle-aged, often there's less flow of cerebrospinal fluid, maybe half as much. And people with senile dementia, we found in our research, their flow is actually even 75% less than a normal adult. So what happens, it's like a river that's flowing, then the water table lowers, then when the river starts to dry up, all the mud and sludge and silt clogs up the river. That's equivalent to the amyloid plaque and neurofibrillary tangles, which strangle the brain.
Neurofibrillary
Tangles, which is a fancy word for gunk in the brain.
Gunk in the brain,
Yes.
Okay, good.
And craniosacral therapy can help increase the flow and pump up the volume again of cerebrospinal fluid and moisturize it. And even doctors, even not familiar with what we're doing, would say, yeah, we notice a lot that as people get older, their brain seems like it draws in and shrinks a little bit. The brain literally dries out. And Alzheimer's is like brain shrinkage on steroids. The brain becomes so brittle and dry, when you look at an image of an Alzheimer's brain, it looks like a dried up prune or a walnut. And this craniosacral therapy can help encourage that flow and wash those toxins away from the brain.
Wow. Now, are there any myths or beliefs about Alzheimer's you want to dispel?
Well, I don't know if it's a myth, but it's a commonly held belief, which is, I understand the point, is that the American Alzheimer's Association will tell you there's no known cure for Alzheimer's. And that's true. However, what we're looking at is saying, which is part of the context I'm looking at, is I'm looking to change the paradigm of healthcare for Alzheimer's dementia. I'm saying that Alzheimer's can be preventable and it can also be reversible. So that's one aspect of looking at this disease. So that's something that we're kind of countering the common way of thinking about it. And the other myth is that commonly Alzheimer's has been thought to be the 6th leading cause of death in the United States, which is bad enough, 84,000 people a year. However, researchers at the University of Rochester started looking at the death records of people a few years ago, and they found out actually what most people die of with Alzheimer's is not the brain function itself, but more like respiratory or cardiac distress. That would peg Alzheimer's as about 500,000 deaths a year and make it the 3rd leading cause of death in the United States.
Wow.
And even the American Alzheimer's Association is saying, yeah, it's a bigger threat than we even thought in terms of that crisis to people and loved ones.
Well, both of my parents had Alzheimer's and dementia when they died. Yeah.
Wow.
And my mother died about 10 years ago. My father just in this last year, but totally not present. You know, very sad to watch. I wish I'd known about your work. I didn't.
Well, I'm sorry to hear that.
Yeah. Anyway, I've read or heard about Alzheimer's being referred to as type 3 diabetes. What does that mean, and how does that relate to your work?
Well, this is part of how my story unfolded. I thought, well, here's my relatives that had died, and I created a 2-day class that lay people can learn just a few simple techniques like the still point. And I met with a fellow on the board of directors of the Southern California Alzheimer's Association. And he said to me, do you know, Mike, about 40% of people in an Alzheimer's unit have diabetes. And I go, I didn't know that. So I started to look into that and started to discover more about functional medicine and found doctors like Mark Hyman and David Perlmutter were starting to call Alzheimer's type 3 diabetes. And the backstory to that is that it's not just that one day somebody wakes up with Alzheimer's, like you get the flu. Basically, something has been brewing for decades before in most cases, as I found in my research. And often it's an inflammatory process in the body. So 10 to 20 years before somebody really develops full-blown Alzheimer's, they may have had any of what I call these diseases of aging. Excuse me, they could have had cardiac disease, diabetes, osteoporosis, any immune system disorder, which in some cases, thankfully not all, but it's as if the inflammation in the body can overflow into the head. So all of that has been brewing. So if you really want to understand prevention, you start to look at the vectors of the disease which start even decades before. If you can prevent those, you won't have a problem in the first place.
That's important. Now, you have worked with lots of people. You train a lot of people to do this work. I'm curious, I want to bring this down and make it more personal.
Sure.
What's a success story you've had with someone?
Well, what we started to do in our initial pilot study is we took people in nursing homes that had mid to late stage dementia, not even beginning. And all we did was this little still point on them for 10 minutes a day. And after about 3 weeks, because it seemed like the momentum had to accumulate with doing the craniosacral, they began to all of a sudden recognize their caregivers. And they began to, one lady, as I mentioned, started to speak in complete sentences. People started to be more cognizant. If people are in, not more like early onset, what happens is that A, they start to be more relaxed, as you noticed when I did the still point on you.
Right.
And then in that relaxation, all those toxins clear, they start to remember things more easily. They're less confused. They can actually find their keys instead of losing them. So we've had a lot of results with that as we're continuing to document our success with this.
That's great.
Yeah.
That's great. That's really good. So most people, here I am, I'm pretty well read and I know a lot about stuff, and I just didn't know about this. And as I
Right.
just mentioned with my own parents. So what advice would you give to our viewers out there, based on everything you now know about Alzheimer's and craniosacral therapy and the still point and so forth? Our viewers are watching this and going, okay, so what should I do?
Well, the first thing is just get educated and understand what the causes of this is. Get educated in terms of prevention and what can be done in terms of reversal. They can take a look at my book, The Body Energy Longevity Prescription, just to get the background. And then in the education, like my website, preventingalzheimers.com, they can go to and actually look at how to enroll in webinars to get educated, and then find a national referral network we have of trained craniosacral therapists in their local area, so they can actually get the work and even attend a 2-day training program to learn how to take care of their loved ones.
Now this is radical.
Yeah.
I said to you this, I said this to you as we were talking before, you can train people, lay people, to do some aspect of this work,
Yes.
correct?
Yes.
And so it's like every family, or everyone who has someone they're concerned about, or perhaps someone is already moving into the Alzheimer's or dementia, you can actually teach them in a
Yes.
workshop
Yes.
how to be of service and stop the progression, potentially reverse this.
Yes. And one story, I've been to Russia like 5 times the last 4 years. And in Russia, they don't really have a healthcare system per se, but the doctors over there, the osteopaths and the neurologists that I regularly teach, they want to teach their family members because they want the family members to be able to take care of each other. So it can be like a family and a community. So in that aspect, it's very important. And yeah, people can, Dr. Upledger, who was my mentor, always thought that he really believed in self-empowerment, so that everyone could really help each other and be more independent in terms of their health care, and use the healthcare system also as an adjunct to that.
Oh, this is beautiful work. I'm really excited to make my viewers aware of you and your work. So here's the book, The Body Energy Longevity Prescription. It's almost like a tongue twister. The Body Energy Longevity Prescription. So make sure you get a copy of this, because what is the incidence of Alzheimer's? What's the percentage of people end up with dementia or Alzheimer's?
1 in 6 women over the age of 60. And with men, not as high, but there's 5 million people that currently have it, and that number is expected to triple in the next 10 to 15 years.
So learn how to make sure that's not you, and learn how to make sure that you can help people you love in your family, your parents, your spouse, perhaps even your children. Anyway, this is a wonderful book. You're a wonderful man. You're doing great work. You have a website where people can go?
Preventingalzheimers.com is the best place to find us.
Preventingalzheimers.com. Okay. Well, thank you for joining me today,
Thank
Michael.
you, Jack.
Really
Thank you very
appreciate
much.
it. All right. You all stay tuned. We'll be right back after this message.